You're doing exercises for your L4-5 disc bulge, but the pain isn't going away, or it's actually getting even worse. Thousands of people try to fix their disc bulge with stretches and rehab exercises they've seen online, not realizing they might be skipping the most critical step in the healing process. After treating thousands of patients with disc injuries, here's what I found. Exercises work, but only if your spine and your disc is ready. In this video, I'll compare spinal decompression therapy with exercises side by side, break down exactly when each one works best, and show you the simple, overlooked phase of treatment that makes all the difference. If you're stuck, scared of back surgery, or sick of wasting time, you're about to discover the real path to relief, without the guesswork. Hi, I'm Dr. Kevin Wafer, a chiropractor based in Houston, Texas. I help people overcome disc bulges, sciatica, and chronic spinal issues without surgery or risky medications using targeted chiropractic corrective care. This channel is for busy people dealing with pain who want real, practical strategies to relieve pain, restore mobility, and prevent future flare-ups. Subscribe now if you want expert tips, simple exercises, and proven solutions that help you move better, feel stronger, and stay pain-free. If you've been diagnosed with a lumbar disc bulge, you may already know the basics. What you don't know is why the pain is still there, despite everything you've tried. The back pain, the leg pain, maybe even tingling or weakness. It's not just uncomfortable, it's frustrating and exhausting. You've probably tried stretches, maybe core work, even rehab exercises you found online, but nothing is really changing. And that's the part no one explains. Because knowing you have a disc bulge is one thing, but figuring out how to actually fix it, that's the hard part. So when it comes to healing, most people turn to exercise first. But is that really the right move? Here's what most people don't realize. These exercises, even the right ones, can actually make things worse if you start too soon. Think of your disc like a swollen sponge becoming compressed. If it's still inflamed, still under pressure, and you add even more load, even with gentle movements, you're not helping it heal. You're just pushing against a structure that's already irritated. That's why so many people say things like, I feel good stretching, but then the pain just comes right back. Or, core work helped me for a week, but now my leg pain is flaring up again. You're not doing anything wrong. You're just doing it at the wrong time. Here's the key. You shouldn't start rehab exercises with a disc bulge that's still inflamed and under pressure. Until the disc is given space to decompress and calm down, most rehab exercises just pile on more irritation. This is the frustrating cycle that keeps people stuck, improving one week, flaring up the next, but never really turning the corner. So, what should come before exercise? That's where spinal decompression comes in. When people hear spinal decompression, they often think of traction, getting stretched on a table and hoping it feels better afterward. But spinal decompression isn't just yanking your spine apart. It's a controlled, targeted process that gently unloads pressure from the disc, especially the discs at L4-5 and L5-S1. Here's how it works. A specialized table applies a specific amount of pull in short, repetitive cycles. Not too much, not too little. The goal is to create space around the disc so pressure on the nerves starts to ease off. That pressure reliefs more than just reduces pain. It allows water and nutrients to flow back into the disc, exactly what it needs to start healing. Think of it as taking your foot off the brake before hitting the gas pedal. If the disc is compressed and inflamed, no amount of stretching or strengthening is going to help until you relieve that pressure. Now, let's be clear, spinal decompression is not a magic fix. However, it does have an over 80% success rate. For many people, it's the missing step that makes everything else actually work. Once the disc is calm and unloaded, the body's natural healing process can finally start doing its job, and then the right exercises can help move you forward. So, what happens when you use spinal decompression before jumping into exercises? That's where things really start to change. To understand what works and when, we need to look at spinal decompression and exercises side by side, because while both are valuable, they serve different purposes depending on where you are in the healing process. Let's break it down. Spinal decompression's goal is simple: reduce pressure inside the disc. It's passive, meaning your body isn't doing the work. The machine gently stretches and releases the spine in cycles, allowing the irritated disc to unload and breathe. That space helps reduce nerve compression and inflammation, creating the environment your body needs to heal. Exercises, on the other hand, are active, meaning you are doing the work. They're meant to build strength, stability, and flexibility, especially in your core, hips, and spine. But here's the key. Exercises only help after the pain has settled and the disc is stabilized. When should you use each? Decompression works best in the early phase, especially during flare-ups or when the nerve symptoms are intense. Exercise is more effective in the mid to late phase when you're not fighting inflammation and you're ready to rebuild. What happens if you get the timing wrong? With decompression, the risk is low. It's gently controlled and rarely aggravates symptoms. But exercise, if done too early or with poor form, it can actually worsen the disc pressure and set you back weeks. What are each best for? Decompression is indicated when the pain is sharp, radiating, or stubborn. It's especially helpful for people who feel stuck or haven't responded well to rehab. Exercises are ideal for long-term recovery, preventing flare-ups, restoring strength, and improving how your spine moves and handles future stress. And here's the most common mistake. People think spinal decompression is only for severe or surgical cases, so they skip it entirely. And they treat exercise like the first solution, not realizing it only works if the disc is ready. The real power comes from using the right strategy at the right time, and that's where most people go wrong. So what should you do now? Here's a simple 3-phase roadmap for lumbar disc recovery. Let's take everything we just covered and make it actionable. If you're still in pain, here's the roadmap we use with our own patients to guide them out of the cycle. Phase 1. Decompress the disc and calm nerve irritation. Your first goal isn't movement, it's relief. This is where spinal decompression therapy really shines. The focus here is on reducing disc pressure, calming nerve irritation, and creating a healing environment. If you're still feeling leg pain, tingling, or sharp back pain, this is where you need to start. Phase 2, stabilize the spine. Once the disc is calmer and the sharp symptoms have eased, then and only then start introducing gentle core stability exercises. This isn't about planks or crunches. It's about controlled, precise movements that teach your spine how to move without re-injury. Phase 3, build strength and resilience. This is your long-term plan. Think of it as future-proofing your spine. Now you can safely focus on strengthening, improving flexibility, and reintroducing movements without fear. This is also where traditional rehab finally starts to work. The bottom line, if you start with phase 3 without unloading the disc first, you're likely to stay stuck with pain and even make things worse. But if you follow the right steps in the right order, you can finally move forward without the setbacks, without the surgery scare, and without wasting any more of your time. If you've been feeling stuck, overwhelmed, or just plain frustrated with your lumbar disc bulge, I hope this gave you something you haven't had in a while. Clarity. Now you understand why exercises might not be working and why spinal decompression could be the missing step in your healing. You're not broken. You just need the right strategy at the right time. So if this video helped you feel more hopeful, more equipped, or just more confident about your next step, like and share it with someone else who's been dealing with the same pain. And if you want real, honest answers about disc healing, recovery timeline, and what actually works, subscribe, because that's exactly what we do here. Got a question or stuck figuring out where you are in the recovery process? Drop it in the comments. I read everyone. And if you want a deeper dive into how spinal decompression works, what results to expect, and if it's the right move for your lumbar disc bulge, the next video you need is to watch is this one. Lumbar disc bulge, does non-surgical spinal decompression actually work? Go watch this video now.